The Heart's Secret Shortcut, a guide to Wolff-Parkinson-White syndrome. Welcome, future doctors, to the curious case of the heart's secret shortcut. Inside every heart, there's a superhighway for electricity called the AV node. Think of it as the main road. But in some hearts, there's a little-known side street, an accessory pathway called the bundle of Kent. When this shortcut causes trouble, we call it Wolff-Parkinson-White, WPW Syndrome. Normally, electrical signals travel from the atria to the ventricles down the main road, the AV node. This creates a slight, crucial delay, allowing the ventricles to fill with blood. But the accessory pathway is impatient. It creates a shortcut, letting the electrical signal bypass the AV node and get to the ventricles too early. This is called pre-excitation. How do we spot this secret shortcut? With our trusty friend, the electrocardiogram, ECG. The ECG in WPW has three classic clues. First, because the signal travels so fast through the shortcut, the time from atrial to ventricular depolarization, the PR interval, is short, less than 0.12 seconds. The second clue is the most famous, the delta wave. Because the ventricle is activated early via the shortcut, the initial part of the QRS complex is slurred as the impulse slowly spreads. This slurring is the delta wave. It makes the whole QRS complex look wider than usual, greater than 0.10 seconds, which is our third clue. Remember the triad, short PR, delta wave, and wide QRS. Sometimes, the signal gets stuck in a loop, going down the normal path and back up the shortcut, or vice versa, creating a re-entry circuit. This causes a very fast heartbeat, or tachycardia. If a patient with this tachycardia is stable, good blood pressure, conscious, your first move is to try and slow things down with vagal maneuvers, like asking them to bear down, Valsalva maneuver. If vagal maneuvers don't work in a stable patient, we turn to medications. The first-line drug is usually adenosine. It acts like a powerful brake on the AV node, stopping the signal and breaking the re-entry circuit. If the tachycardia involves the accessory pathway for downward conduction, antidromic, procainamide is a better choice. What if your patient is unstable, low blood pressure, altered mental status? This is an emergency. The answer is immediate, synchronized cardioversion. This electrical shock resets the heart's rhythm. For a long-term, definitive cure, the best option is radiofrequency catheter ablation, where the accessory pathway is carefully destroyed. High-yield exam points, NEAT PG